Dr. John Palmer, endocrinologist at Monument Health, says advancements for continuous glucose monitoring, or CGM, have really transformed diabetes management.
From a patient's perspective, it's so much easier. There's no more fingers pricking. They don't have to test their blood sugars via the conventional method. They're able to see their glucose levels in real time, which is so much more convenient for the patient.
He adds that CGM is important for patient safety.
These devices will alert the patients when they're having high blood sugars, when they're having low blood sugars. And really what we've seen is that's transformed the patient's management, really eliminating those episodes to a greater extent, and then really just having the patient be much more comfortable managing their diabetes.
As for the provider, it helps determine how to treat patients.
It's been an absolute goldmine of data. Rather than looking at a few points in time as far as the blood sugars that they're testing via the conventional glucometer route, I can see patterns. I can see when they're high. I can see when they're low. I can see where we need to adjust insulin, what time of day. And we don't even need to do this in clinic anymore.
Palmer says most common CGMs are Dexcom, Libre Freestyle, and the Guardian.
Those are the three main ones that we primarily use. There is some implantable technology that's out there. But to this point in time, that really hasn't taken off, I think, in popularity, primarily because of how well these self-administered or these self-placed sensors have been.
He says the change in technology since he started has been astounding.
As far as how I manage diabetes in 2022 compared to when I started, in 2009, it's night and day different. I would say the evolution and the continued progress and accuracy and user friendliness of CGM technology, these continuous glucose monitors, has totally changed the way we manage diabetes. I've got some long-standing diabetic patients. We're talking patients in their 50s, 60s that were diagnosed as 4 and 5-year-olds. So you're talking patients with a half century of diabetes, and I oftentimes will kind of kiddingly ask them and say, did you ever think in a million years that you'd be hooked to a device that's telling you what your blood sugar is in real time? These are patients that maybe got their blood sugar checked every 3 months when they had their blood drawn, and they had to use urine sticks to get an estimate of where their blood glucose values were. Now they have this thing in their pocket that's telling them where their blood sugar is at any instance, and it's going to warn them if they're having low blood sugar. It's just astounding, I think, to think where that technology has come. And what's even more exciting is the direction we're headed.